I think families, they need help navigating this healthcare system because it's so hard, it's so complex. And if you are juggling multiple things, multiple kids, family life, work, and it takes so much extra effort just to get your kids all of these services. So I feel like that's the thing I'm most passionate about is how do we help families navigate this system? Because I say it all the time that the easiest part is taking care of my son. The hardest part is scheduling all these appointments, following up with everyone to make sure they did everything correctly. Like, why should I have to follow up with the hospital billing department because they didn't bill both of my insurances? Like, why is that my issue? Why can't they do it? And then they'll call and leave voice messages. Oh, we need you to call your insurance because they're saying the name and the ID doesn't match. You call your insurance and they're like, well, they're not billing it correctly. That's so much wasted time, energy, and effort that I could pour into my son. And I don't think they understand how the system operates. Because like even when I worked at a family practice, you put in the orders and then they go off to the abyss. You never think about them again. But the parents are on that receiving end and they have to figure out where those orders went. How do you navigate it? How do you get everything you need? And my son was in the NICU for 6 months, 183 days. And they set up home nursing for when we go home. So, we get home, we get the nurse, we have to fire the first nurse after like 2 days. So then you're navigating, and I live in a rural area, so there's a lack of pediatric home nurses. So you're trying to navigate that system. You're trying to go to work, and then you pull in the insurance piece of my primary care insurance doesn't cover home health care nursing. So then you're trying to navigate getting your kid onto like a model waiver program to afford home health care nursing. The hospital they didn't know anything about the program. So I actually met up with a family friend who has a kid with complex medical needs, and they told us about the program that they're on. So then I researched it, found out the information, filled out as much as I could, dropped it off at the NICU, like, I need you to do this right away. And my son got approved for what's called the REM program, so the rare and expensive case management, the week before he got discharged from the NICU. Had we been discharged prior to him being on that program, I would have had to quit my job immediately because then he would have gotten home. Social services would have called. They would have taken into account our income. It was like, okay, you're getting kicked off of Medicaid. But because we were on that program, it bought us some time. We were able to bridge into what's called the model waiver program. And so that it took us from it took us from the REM program to the model waiver program, which is where we're on now 6 years later. And there's only 200 slots in the state of Maryland. I had a mom reach out. She had twins. One kid has a genetic disorder. They were not able to get on the REM program. So when they got discharged, they started at the bottom of the model waiver program. And she's been navigating being home, trying to take care of these kids. And now they're trying to figure out what's next. How do we get home health care nursing? Because they're on the bottom of this 200 slot list.